Good morning, everyone. Today I'm here refuting Michael's speech on prescription medication. And his claim was patients are failing to adhere to the directions of healthcare professionals about prescription medications. And his three secondary claims were: 1, patients fail to follow medication directions; 2, patients neglect to acknowledge side effect warnings; and 3, prescription medication patients contribute to the drug abuse epidemic in America. So his first point, again, was patients fail to follow medication directions. And my response to that is actually that patients have a hard time following medication directions because of cost. So the Food and Drug Administration posted an article on their website in February of 2016 stating that cost can also be a factor causing medication non-adherence. Patients can't afford to fill their prescriptions or decide to take less than the prescribed dose to make the prescription last longer. And that quote right there was exactly the quote that followed the quote that Michael used, saying that many patients don't follow their healthcare provider instructions on how to take medications for various reasons, which were something along the lines of forgetfulness and multiple or different medication regimens, and not understanding the directions carefully. So one thing that Michael failed to left out was the fact that cost is an issue for a lot of people as well. Okay, and then from there he moved on to patients. His secondary claim was that patients neglect to acknowledge the side effect warnings. And what I was able to find was that patients are actually not aware of the severity of some side effects. And again, in Michael's speech, he mentioned that 100,000 Americans die from the side effects of their medications each year. But that doesn't include the Americans that don't regularly take their medicine. And it could have been a patient's first time taking the medication, because we know nowadays, I'm sure many of you are aware of those commercials for a whole bunch of different medications nowadays. And it lists their long side effects, and sometimes the side effects of some prescription medications is even death. They mumble all the different side effects, and one of the last things they actually say is death. So that can be a contributing factor to this. It's not just patients failing to adhere to their directions of their medicine. So an article on the challenge on patient adherence published in September of 2005 by Leslie Martin states that in some disease conditions, more than 40% of patients sustain significant risk by misunderstanding, forgetting, or ignoring healthcare advice. So it's a matter of not knowing how severe some of these side effects could be, not just mere ignorance. And then Michael's third secondary claim was that prescription medication patients contribute to the drug abuse epidemic in America. And Michael was right on this point. It was a little difficult to find anything on the other opposing that. However, his evidence from the drugfreeworld.org fell a little flat for me. When I was trying to read into it, I couldn't access it at all. I was having a very hard time finding it, and I wasn't able to access anything. And the fact that it was an organization doesn't say where they got that information from, who conducted that study, when was that published, how recent was that. So I felt that it was a little vague in where it came from, and it would make it more credible if we knew who and where it came from. So I was able to find an article titled Results from the 2010 National Survey on Drug Use and Health, and the article was titled Among persons aged 12 or older in 2009 to 2010. Oh, I'm sorry, that was the quote. They stated that among persons aged 12 or older in 2009 to 2010 who used pain relievers non-medically, aged 12 or older in in the past 12 months, 55% got the pain relievers they most recently used from a friend or from a relative for free. And another 11.4% bought them from a friend or relative, which was significantly higher than the 8.9% from 2007 to 2008. And 4.8% took them from a friend or relative without asking. So it's not just people not adhering to their pain medication, it's those that are just lying in a medicine cabinet and children who have access to that as well. So to conclude, Michael's speech was pretty effective, but it failed to prove other instances of why people don't adhere to their medications or why this is a big epidemic in America. So my points were that patients have a hard time following medication directions because of cost. 2, patients aren't aware of the severity of some side effects. And 3, what Michael also said was that patients contribute to the drug epidemic in America. Thank you.
Thank you. Thank you. What? I don't. Thank you.
Just kidding.
What?
All right, well, most of the problems here have to do with the problems that I mentioned about Michael's speech originally, and that is that I'm not exactly sure what's in dispute here. It seems to me like everybody agrees, patients don't always do the right thing. Now, the best argument that you have is that they don't do the right thing for a very different reason than Michael suggested. It's not that they're ignorant, it's not that they're uninformed, it's not that they're unwilling to follow the directions, it's that they can't afford to do that. So that's the clearest argument in your presentation here, that there's a counter causality for why this occurs, and it's not just, basically patient stupidity, that there's an important factor here that hasn't been accounted for. That aside, we're back to the same situation. You agree that patients don't do very well with their medications. He agrees that patients don't do very well with their medications. Everybody seems to agree that nobody's doing great with their medications, so what is it that we are arguing about? I'm not exactly sure what the controversy is. The side effects issue, I do think that you've got a couple of good presses on that. Look, sometimes people have their first exposure to a medication, and it's not because they took the medication wrong, it's that they've got an allergy or some kind of reaction to it. The evidence that you have here basically makes a reference to, it's kind of judicial notice. Everybody has seen these ads with all of the side effects listed there. There's not any evidence or information that suggests that the people who died did so the first time they took the medication, and that's when they discovered that it was toxic or problematic for them. That, I think, might go a ways to suggest that it's not really, again, patient ignorance. It's just that everybody responds to medications a little bit differently, and so that could be the problem. I think maybe that might be a good answer on this particular point, is that, of course, the purpose of the research is to make sure that the medication is safe and effective, but there are variations within that range, and we can't account for all of those things. That's just an inherent risk. Anytime somebody is sick and they're taking a medication, maybe they'll get better, maybe they won't. The idea is that they're more likely to get better if they take the medication, but sometimes the medication creates problems for them also. That's an inherent risk that exists there, and it's not because patients are stupid or dumb or don't follow the doctor's directions. It's because the medication is just dangerous in some circumstances, and there's no dispute about that, but his argument is that it's because patients are not following directions, and I think maybe that would be the way to go on that particular point. And on the third point, you basically agree with him. You kind of outlined some of the other explanations on this, but everybody seems to agree that a lot of people who abuse the drugs get them from people who have the drugs that are in their families. And I'm not sure how much you gain by pointing out that it's 11% who get it by paying for it rather than 8%, which is what he cited from 3 years ago. Okay, why is that important? I'm not sure that it is important. There might be other arguments to make on this issue, like maybe we have better ways to prevent this. Maybe prescriptions need to be more carefully monitored by the pharmacies, that sort of thing. I don't know how they would do that. but it seems like there might be some other response that's going on here. I thought you had a tough job to begin with because the issue is, like I said, there's a little bit of conflict on it, but not much. Most of it is really, it's a presentation of stuff that people seem to acknowledge as true. So we've got a bit of a problem there. I thought you tried to make arguments, especially on that first point, pretty effectively. And at the end, it did sound a little bit like you were doing more of an evaluation than a refutation, and that's not what we're looking for here. I think I would have gone after the idea that it was an argument and just said, nobody disputes this, so I don't know why it is that anybody should answer this. Yes, that's true. Yes, that's true. Yes, that's true. So thank you very much for presenting that. Now, is it important? Is it anything that we can do anything about? That's where the conflict is, and here are some answers on that. That might have been maybe a way to go. All right, but I appreciate your efforts. All right, thank you.